I am finding this. Today also we had a meeting, but out of all the races, Indians have the highest chance of getting early heart attack and also chance of getting early diabetes and hypertension. Now, today the meeting was about role of CT angle. So the presenter was telling a majority of the any patient who comes to the ICU who are below 40, majority are Indian. We have a peculiar problem where people who are younger than 40 years also developing from the age of 22, also developing heart problems. Some are getting admitted with heart attack. So nobody is safe now. For that, why? Because metabolism is not taught in our colleges. I thought metabolism will be a specialty. So I dedicated my last 8 years only to develop a 360 degrees about metabolism. We cover cardiology, neurology, nephrology, and geriatrics, and also basic physiology, applied physiology, and diabetes, hypertension. So metabolism is one specialty which I believe will be covering everything. Everywhere there is a need for metabolic specialist. Why? Because last 30 years there is a sudden increase in obesity in India and also the world. Here you can see NWCO, normal weight control obesity. 90% of the doctors are outside or who are not in touch with general medicine or cardiology or diabetes. Everything sounds new to them. They are the majority of people. I am focusing on doctors who are working in rural areas, field areas, really in touch with the real world. So with the real world evidence, after 30 years of experience, I thought still waiting for HbA1c or total cholesterol or LDL is a waste of time. By that time, patient is already developing one-rat disease. So our goal is to reduce one-rat disease, diabetes, and obesity by creating an army of doctors specialized only in metabolism. After MBBS, it should be easy, palatable, easily understandable, and should be approachable. Same can be replicated at multiple centers. That is the goal. In that, normal weight central obesity is one easiest method. How to make out central obesity? There are four pathways. First step is simple waist circumference, just taking a tape and measuring around between the lower part of the rib and the bony point of the pelvis. The central part is called central part of the waist circumference. Approximately we take it as around the umbilicus. But soft tissue should never be taken as a target point when we are teaching. You should teach as a what is the center point of waist circumference between the lower part of the ribs, floating ribs, and the pubic symphysis. That is usually most people around umbilicus, and both in men and women. The cutoff point is less in India when compared to other countries. Our cutoff point is 85. So the average is to take 80 to 85 centimeters, 80 in women and 90 centimeters in men. Whereas in Western countries, it is up to 105 it is normal, and in some books 110 also it is normal. So their metabolism is different from our metabolism. I want to make the HOMA or homeostasis model of insulin resistance completely dedicated to Indians in all the 165 countries where we can detect early underartery disease, hypertension, and diabetes by taking these newer markers. So I have a newer clinical markers and newer biomarkers. Once you get the doubt that there is a central waist circumference more than 85 centimeters, they are always looking at the biological aging, not at chronological aging. So 22 years, 32 years, 42 years, 62 years, chronological aging. Biological aging is how much of the liver, kidney, brain, and heart are aged for that patient. For them, if they are 100 years old, means even if the patient is 22, you have to take it as a older age group. That we can make out by using the number of new biomarkers. Once the waist circumference is more than 80 centimeters in women or 90 in men, next test is DIA, third is DEXA scan, fourth is CT scan, fifth is MRI. Now there are cutoff values for each level. So anything in DEXA scan more than 33% is taken as a central obesity. 1050 ml cutoff point for MRI. Gold test for central obesity is MRI, where it is 750 ml total fat per gram. 750 ml is taken as a MRI cutoff value for central obesity. So visceral fat we are able to measure. DIA is a older model where we give a signal to the body, and wherever there is a fat, there is impedance, and that there is a calculation. But the problem is DIA values go very half as well. They are all available at all the metros. So take is 1 rupee, DIA comes here on 100 to 200 rupees. DEXA scan costs 800 to 1200 rupees. DEXA scan is again 2 types, bone scan and fat scan. Total body mass, DEXA scan is different. Left to right, DEXA scan for total body mass. So in this we will get 4 body mass which contains organs, fluid, tissue and all other things. Whereas fat is different and muscle is different. So skeletal muscle index will get AMI, will get the total fat, visceral fat, subcutaneous fat, how much it is there in DEXA scan. Laterally, now recently, things like CPS come. With that, there are cutoff points have come. Very recently, last 1 month, they are introduced. But MRI is a gold test, and PML is a cutoff value. What than the visceral fat. So there are two types of fats, subcutaneous fat and visceral fat. So fat first is not that. Fat around the visceral area is that. This is called NWC, normal weight control. MONW. Metabolic abnormal obesity with normal weight. So in India, we look at weight, BMI, blood sugar, cholesterol, which is all are fat. But still, if you see, patient will develop for that and so this is how this affects their starting seminar every day to educate the patient, doctor. Everyone is going to be subject. So everybody is looking at the key of the method. It's trying to create